And actually it got a lot worse throughout the days as well, where my back, I just couldn't actually sit for any amount of time at all. Walking around was a big pain in the butt, and I also had a kid around the same time too, and so it was just a terrible time for me, where like every day was in a ton of pain, lots of painkillers every day, and I actually saw probably about 4 doctors total, all of them giving me varying stages of advice, but all of them geared very much towards, we'll start with some physical therapy, and then you're going to go down this chain, eventually leading to surgery.
I'm Matt Chu from Upright Health, where we help you think right, move right, and feel right. If you're new here, on this channel you're going to discover a lot of videos that help you solve your own musculoskeletal problems. Whether it's back pain, shoulder pain, knee pain, hip pain, we've probably got a video for you. So be sure to check out our other videos that you'll find linked in the description box. And don't forget to subscribe. In this video, we're going to be sharing the experience of one of our clients here at Upright Health who struggled with back pain for about 5 years. We're going to look at his story to highlight some of the problems with getting a solution for back pain when you're going to doctor after doctor after doctor. And at the end of the video, we're going to talk about 3 simple strategies that'll help you get out of back pain safely and effectively over the long run.
Every single one of these doctors, I would get an x-ray. They did, say, oh, you might have a little bit of scoliosis here and there. But then as my problems kept progressing, eventually it led me to getting an MRI, where we wanted to see if there was any disc issues or anything like that. And I believe my MRI showed a disc herniation at the L5, S1, and a little bit of a protrusion on some other thing. But they were all claiming that because the protrusion was on the right side, which is where I was really experiencing the pain, that's where the surgery would happen, and all that stuff. This was right after a bunch of Golden State Warriors news about Steve Kerr's botched surgery, and so I was very hesitant to go down surgery, so I was like, yeah, I'm going to do all this physical therapy, get right back on track, and I'll be back on the basketball court.
The first key point that makes the medical approach to back pain so frustrating is that doctors are often focused on a structural deformity. As you can hear from Roger's story, every doctor he saw was looking at his x-rays or MRIs to explain why his back hurt. Nobody's really thinking about what the specific triggering movements had to do with anything. Nobody was looking at how his overall life and the activities he was engaged in were affecting his back. They weren't looking at movement patterns, they weren't looking at strength, they were just looking at one picture of one piece of his anatomy to try to explain his back pain, and that is a strategy that doesn't work. Study after study shows that what you see in an X-ray or MRI has no link to symptoms. People can have terrible arthritis in their spines, terrible arthritis in their knees, terrible arthritis in their hips in x-rays, and have 0 symptoms of problems. So to look for structural deformities is actually just a huge waste of time unless you see something really, really significant like cancer, which is going to be a pretty rare finding.
So after I stopped progressing, I went back to the doctors, and they prescribed me an injection in my back, in the lumbar spine. So I got that, and I believe it kind of helped. So it did, at least psychologically, helped me think that everything was getting better. And I did experience some lower amounts of pain just sitting around. But the problem was after I got that injection, what happened was I wasn't really able to even walk or stand for more than 3 minutes. And so it's super hard, just standing for any sort of meeting, I would have to sit. Walking, I could probably walk 200 yards and then I would have to sit because everything was in such terrible pain. After the injection didn't help, they wanted to actually inject me again, at which point I was very hesitant because of the walking issues and the standing issues that had arisen before. And so the next step that was given to me was, okay, if you don't want to do that, your next step is consult with a surgeon. But at the time they also said, yeah, surgery is probably a 50-50 for you because you've been injured for so long that, your chance of fully recovering is a crapshoot. At which point, that also was another nail in the surgery coffin for me, where I was like, no, I'm not sure I want to do this, especially if it causes more complications and all that. And I'm super thankful that I didn't actually go through with it.
The second big problem with the medical approach to back pain today is that it's frequently focused on passive treatments. As Roger's story illustrates, there are injections you can get and surgeries you can get. There are painkillers you can get, but there's not a lot of really proactive solutions on offer if you have recurring chronic back pain besides physical therapy.
I actually went through a couple of different sessions. So my very first session was right about 2 weeks after my initial injury. And so it was very, very basic, but getting me back up to speed. So I would actually visit every 2 weeks for a grand total of, I think, 8 weeks. And so at around like the 6-week mark, I started to plateau, but I didn't think anything of it. And we continued until the prescription ran out. And at that point I thought, yeah, I'm doing better. It wasn't fully healed, but I thought that I could actually make it. But then it just kind of stopped progressing. And so no matter what exercise I did, I was just kind of stuck at a particular level. Once I switched providers, I never really saw any improvement there. But because it was kind of subsidized and it was so easy, I went to that for probably around 3 to 4 months, just kind of not really progressing, doing all the different exercises that they would prescribe, but it just showed no improvement.
The third thing that makes the medical world so frustrating when you have back pain is that there's no vision for you getting back to doing active things in an active life. The way they treated him in physical therapy was as a really fragile person, and they didn't want him to do anything that would potentially make his back hurt again. Now, it's understandable that you're trying to avoid pain, but what you really want to do is not just avoid pain, but actually make your body more functional and more capable of doing more things. So in the medical world, there's often this fear of re-triggering pain. So to avoid that, you just do nothing. Never lift your hands overhead. Never pick something up off the floor. Don't hold your child anymore. Never play golf, tennis. Never try to climb on anything. Never try to wash the dishes bent over a low sink. Never try to empty the dishwasher. If you follow this advice, your whole life and all the things in your life start to shrink until all you can do is sit around. So let's talk about 3 strategies that you can use right now if you have back pain. The first thing you need to do is realize that the way doctors currently approach back pain is the result of a specific perspective and philosophy. That is a perspective and philosophy that comes from orthopedic surgeons. Now, if you want to hear more about this topic and more details about this, check out the link to the podcast episode in the description box. But to make it really short and sweet, orthopedic surgeons are the ones who have come up with ideas about what causes joint pain. And their solution, unsurprisingly, has to do with surgery. So all the ways doctors have been trained to look at back pain have historically been generated by the idea that eventually the problem is a structural one that needs to be fixed surgically. The second thing that you need to do is decide that you are going to solve your back pain yourself. That means looking for answers that help you gain control and gain function. That means being able to play the sports you want to play. That means being able to pick up your child. That means being able to lift your luggage and move around like a normal person again. It's not enough to just be out of pain and to get rid of back pain. Your real goal is to be able to live your life without restriction, and that's what you should be searching for, and the only person that can do that for you is you. The third strategy to help you get out of back pain and get your life back is to be curious and persistent. Learn anatomy, learn where muscles connect, learn what the muscles do around your back, around your hips, around everything. Learn different exercises, different stretches, learn things that challenge your body safely and gradually. And while you're doing all this, understand that you're probably going to make a few mistakes here and there. But your body is resilient, so you should be persistent. Remember that if you strain a muscle, it's only going to be temporary. Even if a muscle has been painful and stiff for a long time, that's still only temporary. The human body can withstand motorcycle accidents, being thrown out of windows, falling off buildings, skydiving accidents. It can recover from some pretty severe, shocking events. Straining a muscle, tweaking something is not going to last forever. Just accept it as part of the process of learning what your body needs to feel good. As you're learning about your body, remember that you're learning about your specific needs. What works for one person may not work for you. Some people's back pain may come because they have really weak hips or really stiff muscles in their back, or maybe it's because they have really weak abdominals. It could be all kinds of things. Maybe it's poor postural habits. Maybe it's an asymmetrical workstation where you're twisted all day long. There can be a number of factors that may apply to you or not apply to you. So don't think that just because one solution doesn't work for you, another one won't work. You want to keep experimenting and discovering the key pieces for your body in your context.
Before, when I was actually very hurt, I couldn't carry my kid as like a toddler, or he couldn't even really walk. He was an infant at the time. And so it was super difficult. I would kind of put all the responsibilities on my wife to deal with all that stuff. And so it caused a lot of stress, in my daily life. Just existing was a very painful experience, but now that all this pain is kind of gone, I'm a lot stronger in a lot of ways. I can actually throw my kids. I'm never really worried about it. They'll sit on my shoulders, all the crazy positions that you can possibly get into with a toddler, we get into. And he's also a lot bigger now too, so I never feel any sort of pain from any of these things, and it's been a total 180.
Roger got a happy ending to his story because he kept trying and was persistent and eventually trained with us here at Upright Health. If you want to see his whole story, check out the description box for a link to the full video, and you can also check out the link here above. All right, so let's hear from you now. What strategies have you found helpful when you get frustrated with back pain? Leave your answers in the comment section down below, and your answer will probably help somebody else with back pain. If you're struggling with back pain yourself, be sure to check out the description box for a bunch of links that can help you with your back pain. And check out the link up here above to the Back Pain Fix program, which is designed to help you systematically troubleshoot postural issues, hip issues, core issues, all those many things that can contribute to a dysfunctional and painful back. I hope you found this video useful and that it inspires you to fix your back pain yourself and take control of your life again. I'm Matt Shu from Upright Health, reminding you that pain sucks. Life shouldn't.